Hello and welcome to the Primetimers. I'm your host Marty Moore, and we're visiting at St. Mary Mercy Hospital, and we are going to take you to the Senior Health and Fitness Fair. Check it out, see what's going on. Nice to meet you. I'm Marty Moore, and you're?
Hi, I'm Carrie Hayes-McElroy. I'm the Director for Senior Services here at St. Mary Mercy Hospital.
So you've been putting this whole thing together for weeks and weeks?
We have, actually. The past 2 or 3 months, we've had a whole planning team working on putting it together.
What are some of the things you're going to be featuring today?
Well, we have a number of educational seminars. We're focusing on healthy positive aspects, of aging. So we have a seminar on healthy strategies for aging, and then we have a session on what to expect from Medicare and healthcare reform. We have a couple of our orthopedic surgeons talking about joint issues, joint replacements, and surgical options. And we have physical therapists talking on fall prevention, and we're doing balance screenings, we're doing hearing screenings, and there's a number of agencies here from other facilities with resources from the community.
And so you'll be at this all day?
We're here till 3:30. Yes.
Yep. And I'm wishing you a wonderful turnout, and I look forward to meeting some of your representatives that are here today.
Yeah, great. Well, have a great time.
I know
Thank you so
busy.
much for coming.
Thanks for your time.
Thank you.
Talking with John, and John, I wasn't aware this is your very first fitness fair.
Yes, it is. This is the first senior health and fitness fair that we've put on. It's very well attended. We had about 150 people pre-registered
Wow.
for the fair.
And I also understand it's almost the first year anniversary of opening the senior emergency room.
Precisely. My
Tailor-made for seniors.
Only for seniors, that's true. My duties consist of bringing the senior emergency room to the general community. I'm the community liaison for senior services, and we have had an absolutely great response.
Jill is here from Ann Arbor, representing St. Joe. Tell us what you're doing here at the fair.
Well, I'm a social worker at Senior Health Clinic, which is a geriatric outpatient clinic on the campus of St. Joe, Ann Arbor. So we provide primary care services to older adults 60 and over. We also do consult services for those folks who have concerns of memory loss and depression. So we offer sort of a full range of services, not only for our older adults, but for their families. We provide resources in case someone has Alzheimer's disease.
Yeah.
Really help them through that journey. So that's kind of what we do. As a social worker, I'm able to provide the resources for families who are just learning that perhaps their loved one has this
So
type of
if they were
disease.
at the hospital, they would be referred.
They could possibly be referred through our new senior ER as well. So.
Okay, so I thought we might as well get that in there.
Yeah.
It's a great fair. I've met a lot of wonderful representatives. Seniors need to know these things are available.
That's true.
This may help with a little bit of the depression and the worry,
Yeah.
the stress that's involved.
Yeah, because I think if you're struggling with memory and you're not really sure, having an assessment is really the first place to begin.
Well, Glenna, you're going to tell us about Home Instead Senior Care.
I would be happy to do that.
Yes.
We work with seniors in their homes. Our goal is to allow them to stay comfortably in their home. So if they need assistance with a shower, preparing meals, getting to doctor's appointments, getting out the trash, medication reminders, anything that allows them to stay comfortably where they want to be, which is in their home.
Home instead.
Home instead. You got
There's the
it.
name. And your involvement with the fair?
We're here to help St. Mary's to promote to the community all of the resources that are available. We've been in the community 9 years working closely with St. Mary's to keep our seniors happy.
Well, and I think staying home's part of that, being happy if you can.
Home is where you want to be.
Thanks, Glenna.
Thank you.
Well, Audrey, you're part of what's going on here at the fair. Audrey Fry is Marketing Director for
Arden Courts. We are a memory care community here in Livonia. And we specialize in caring for those with memory loss. We are a secured facility, and so we're a live-in facility, and we help those that need care with their memory. So.
I didn't even know that there was someone around that just...
Yes,
My
we do that.
goodness.
Yep. So we're a live-in facility, and we help those that might need care with their memory or respite care. So short-term, if somebody needs to go on vacation and they're caring for their loved one at home, they can move their loved one in with us for a short time as well.
So there's some backup.
Exactly.
That's wonderful.
Exactly.
Audrey Fry, thank you for being with the Primetimers and
Thank you.
participating in the fair.
Thank you.
Well, we bumped into a couple of beautiful ladies here who are representing nursing care.
A skilled nursing and rehabilitation center.
And you are?
Dorothy Roberts.
Nice to meet you.
Same here.
And your facility does?
We do skilled nursing for the community. We are a rehabilitation center. St. Mary's Hospital is one of our largest referral bases, and of course we'd like to thank them for that. We also are Marycrest Heights, and Marycrest Heights is a senior apartment for 62 years of age and older, active seniors. It's a beautiful new building that's up, and we invite the community to come out and to see the new building, to visit Marycrest Manor also, but Marycrest Heights right now is on the forefront. So Sherry here has much more information than I do on the Heights.
Yeah, and so you're from the...
Both, actually. Both. But I can tell you that Marycrest Heights, we do have underground parking, and it's heated. Most of our units are 2-bedroom, 2-bathroom units. We are pet friendly.
Very good.
We hope to have people moving in very soon.
So this is all brand new.
It's all brand new. It's
and
beautiful.
You're here to tell everybody about it right here at the fair.
Yes, we
Our
are.
first fair, I keep saying.
First fair.
Yeah. Well, it's nice to meet you, Sherry.
It's nice to meet you also.
Nice to meet you, Dorothy.
Nice to meet you.
And we'll be right back.
Engines.
Check.
Thrusters.
Check.
Fuel.
Check.
Computers.
Check.
Social Security.
No check, go direct.
That's right, Patty. A few weeks ago, I went online to godirect.org to sign up for direct deposit. It's easy to do, and I got my cash at warp speed.
Wow, it's fast and easy. I'll sign up right now to make sure I'm prepared for our next mission.
MOCCIA is here talking to a robot that could save my life.
Absolutely.
Tell us more.
Okay, absolutely. What we use our robot for, it's actually robotic telemedicine, and it actually gives our physicians to be able to have remote presence at 2 places at one time. And we use our robot, we actually named our robot Buster, beating the clock, using technology to save the brain as a team in the emergency center.
Wow.
And when a patient comes in with signs and symptoms of a stroke, we do encourage them to notify EMS. And when they call 911, they're able to alert us, so prior to the patient's arrival, we can get everything ready. Because one of the things that you want to do is not wait. I mean, time is brain.
Right.
And as you hear of a heart attack, this patient could be having a brain attack. So when our ER medicine physicians come into the room and our nurses, our ER physicians will then do a quick screen on the patient. We're drawing the labs. We want to get the patient to CAT scan right away to see what type of stroke that they have, because 87% of the patients that are having a stroke is ischemic. These patients can be very eligible to get a clot-busting drug called TPA. Our physicians also have the ability to call the Michigan Stroke Network, which they beam in on this robot, Buster. They beam in and they'll move the robot right into the room, and they just, through the internet and like a joystick, they just take the robot right in the room and they interview the patient, an expert neurologist.
So they can generally go room to room or from emergency to emergency, irregardless of where in the world it is.
Exactly.
That's amazing.
Exactly. There was one place where I took Buster with us at an expo, and actually the person that beamed in was all the way in Argentina.
Oh my gosh.
They can beam in from anywhere in the world as long as there's an internet connection. And they go into the room, they talk to the doctor, they talk to the patient, they can have the ability to look at the CT scan, and they can tell our physicians, yes, we're on the right track, this patient's eligible for this, or possibly maybe the patient might be eligible for neurointervention, a different type of procedure. So it's great because we have access to expert neurologists 24/7 by using the robot. And people, you forget when you're talking to the physician on the robot, people actually forget it's remote presence because you feel like the physician is right there with you. We've had patients, their families come and hug the robot and kiss it because it just seems like it's real. We're used to in the emergency center. They should be beaming in shortly, but it really startles people that are in our ER. If all of a sudden they see the robot moving through, they go, oh my goodness. And to imagine they could be thousands of miles away or on the other side of the world to be able to beam in.
This is the first time I've ever interviewed a robot.
Oh, good morning.
Do you find that by having this ability, you can service a lot more people, not just seniors, but babes and moms and that sort of thing?
Absolutely.
More quickly?
It takes the specialists to hospitals that may not have that specialty in their area. So it takes the specialists out to hospitals that may not, patients are normally traveling a couple hours to get to.
Dr. Divany has joined us, and you just conducted a class that's related to this health fair that we're doing.
Yep, so as part of St. Mary's Senior Health Fair today, I'm doing a class on healthy aging. For those that aren't able to go to the class today, focusing on some basic but important steps to help keep healthy for a longer time in the community. We're hoping to focus on exercise, nutrition, healthy eating, as well as maintaining a healthy relationship with the community and how that can be very beneficial to the individual.
By sharing this information with the community, letting them know that there are things, good things that can happen.
Yeah, I think it's really important to maintain those ties with the community and kind of not have people be so, not that I don't want them to be independent, but not to be, feeling alone in the situation. Because there are some very common threads that tie a lot of older adults together, and so our goal is for people to be more aware of what those problems might be and some good solutions to help solve them.
You also work with the family members?
I do. I think that I've a real benefit in the sense that my original training is in family medicine and then my secondary specialization in geriatrics. So I'm very used to working with the whole family, and I think that's the key because really, we're not just individuals. We're really, it is...
Especially as we're getting older.
Yeah, true.
Doctor, thank you for being with us, and we'll just continue on and enjoy your fair.
All right, very good. Thank you so much.
We're talking with Mary CUEVAS, who is a registered dietitian. Mary, tell us what you're contributing here at the fair.
Today at the Senior Health Fair, I made Greek penne pasta salad. We used a whole wheat pasta, which is high in fiber, and we used different kinds of vegetables. We used green peppers, tomatoes, red onions, black olives, and we try to use a lot of colorful vegetables to increase our fiber intake today. And it was great talking to everyone who came today, seeing their faces, and everyone saying they want the recipe and are excited to try it out.
And what's the benefit of high fiber pasta?
High fiber is very heart healthy, as it can lower cholesterol. Okay. So anyone with high cholesterol levels, you want to have a high fiber diet, about 25 to 30 grams of fiber total for the day. Now, you always want to prevent high cholesterol, so getting any kind of whole grains will help prevent that too.
Yeah. Well, Mary, thanks for the info. The salad smells wonderful.
Thank you.
And I just may take a bag of that home with me. We'll be right back.
George, it's a great deal. Only used a couple of times, and it gets great parsecs for very little dilithium crystals.
Well, I appreciate the offer, but what I really need is information about Social Security. How do I find out what my monthly payment will be?
Online.
How about if I just want Medicare?
Online.
Oh my. We'll boldly go to socialsecurity.gov.
Let's go kick the tires.
Dr. Ryan Molly is here at the fair, and you have a lot of things that you're showing people.
I do.
Knees, hips, and...
That's what I do. I'm a hip and knee surgeon here. Operate at St. Mary's, Providence Park, and Huron Valley, which is a DMC health hospital. So I do knee and hip replacement surgery, and really what makes me a little bit different than most knee and hip surgeons is that I do partial knee replacements in about 30 to 40% of my patients, where we don't throw out the baby with the bathwater, as I like to say.
Okay.
If the knee's not diseased in certain areas of the knee, I don't cut it out and throw it away. I replace just the part that's involved. The other thing that I do that's a little bit different is my hip replacement. I do a direct anterior hip replacement that doesn't cut any muscle, which is very nice for rehab. The patients get up, they get moving, same day they're out of bed, putting full weight on it, and most of my patients go home the next day.
Wow.
In one day, out the next. So we have a lot of implants here. My group has a lot of multi-specialty guys. We do spine, we do hand, upper extremity, sports. We have a pediatric guy. We have a rheumatologist that we just hired on, so we do a lot of good things and help a lot of good people.
Well, I see you have a lot of things on display here, Dr. Molly, and for those interested, you know, it's hard to picture.
It is.
What is this thing going to look like?
Exactly.
So I think this could be very helpful.
Absolutely. I mean, it's metal and plastic, and people like to know and get their hands on, so I think it's nice that we can get people from the community in here and actually get their hands on actual implants, which these are. So it's metal and plastic, and we go in, we replace the joint, and we help a lot of people to get back to what they love doing, get them back to doing their activities of daily living, and improve lifestyles.
Dr. Molly, thank you for joining the Primetimers.
Thank you very much.
Primetimers are here with Dr. Brian Nigerian, and Brian, you do also replacement parts, only a different area.
That's right. I'm partners with Dr. Ryan Molly, who I think you just spoke to. We both work for the Orthopedic Institute of Michigan, and we have an office here at St. Mary's in Livonia. And while he is a specialist in hip and knee replacements, I take care of hand and upper extremity injuries. We both just gave a talk to some of the seniors that are here for the Senior Health Day Fair, and spoke about some of the more common conditions affecting the hand and the wrist. That would include various broken bones like wrist fractures. I take care of a lot of patients with carpal tunnel syndrome, trigger fingers, and of course arthritis conditions affecting the hand and wrist, which is also very common.
Kevin Moore is part of the rehab facility here at St. Mary's and just gave a nice talk for seniors
on fall prevention.
Fall prevention.
Yeah. So basically, the older we get, we run the higher risk for a fall. And once you have a fall, the risk factors of really having catastrophic injury from that fall grow tremendously. So we want to prevent those. So we talked about what seniors can do to help prevent that, meaning a lot of environmental factors, making sure your house is free of clutter, that you have adequate lighting. As the older we get, our vision plays a role in that, and making sure that we have adequate vision checks and that your glasses are clean. Also, too, is your physical health, meaning your core muscle group is something to focus on. So, you know, people don't necessarily have to go to a health club to work out in heavy weights and things like that. Walking helps maintain balance. And then if there is an issue, we want to get them to the point where they never have a fall. So if they notice that they're having balance issues or those concerns, come on over to our physical therapy department here, and we kind of address those. Meaning, again, we work on that core muscle group, the hamstrings, the quadriceps, those areas of the body to help improve balance. And again, and also too is give education to patients that what they can do in the home to kind of prevent themselves from falling.
Well, I'm thinking too that once you know what the routine is, to help ourselves not fall, work on balance.
Yeah.
It's not something you walk around thinking about until
Right.
you've fallen.
Yeah, and once you have one fall, the percentage of having another fall within 6 months grows tremendously. And again, if you fall in the bathroom, there's nothing, soft to fall on. So it's that one event that could really change somebody's life. And statistics show that 25% of the people after suffering a hip fracture, 25% of those people expire within the first year. So it's an alarming statistic that we want to prevent people from ever getting to. So again, doing all the things ahead of time before that happens or before you have a catastrophic injury is what we want to do here in the rehab department.
So it is preventable. Rehab can help.
Yep.
And it's open to the community.
Yep. Anybody that
a lot of people don't know that.
Yeah, and people that all they need is a prescription from their physician, and we'll be more than happy to see people. We're open late hours to accommodate an early morning to accommodate people's schedules, and we have a great staff here, and we'd love to assist with people maintaining their level of independence.
Well, thanks for being part of the Senior Fitness Fair. Kevin Moore can help you through rehab.
Great, thank you.
Primetimers is with Sarah Gilbert. Sarah, tell us what your involvement is with the St. Mary Mercy Livonia Hospital Fair. I'm going to get it right. Actually, it's just for seniors to have fun.
Absolutely. That's what today's all about, is just educating our seniors in the community. And I represent the Heart and Vascular Center here at St. Mary. And we're really promoting our peripheral arterial program today, talking about peripheral arterial disease. It's a fairly undiagnosed disease out there. People have pain in their legs. It typically involves patients that are over 50, have high cholesterol, history of diabetes, history of smoking, and over time they start developing pain in their legs, and it's a result of having blockage in the vessels in their legs. And we have a continuum of services here that will help take care of wounds that people might be having as a result of this, as well as endovascular therapy. It's a procedure that's done in our cath lab. We have 2 highly specialized physicians that do that kind of treatment. It's done through a small catheter. It's not an open surgical procedure. It's less painful. That would be Dr. Gardy and Dr. Ilgis. Both are doing those kind of procedures, and actually very life-changing. We've had some patients come through that were about to have amputations.
Wow,
and
that's something.
They were able to open the vessel and allow blood flow through the lower leg and the foot and actually save the limb. So we are here really talking about that level of expertise that we have here at St. Mary, and
this
hope
is
that we can help the community.
It's relatively new as far as people being aware of these things going on.
It is. It definitely is. So we're out here trying to promote awareness that if you have these signs and symptoms, please get it checked out. We do have some screening programs that are available, so that if you want to know if you have this problem, you can come in and get it checked out and then be seen by a specialist.
And convenient, right here on 5 Mile Road.
Right here on 5 Mile Road.
Yeah.
Yes, we're here in your community providing a very high level of expertise to you.
Sarah Gilbert, thank you for giving us this information and sharing with the Primetimers.
Thank you.
I want to thank you for joining us here at the St. Mary Health and Fitness Fair. We had a wonderful time. We hope you did too. I'm Marty Moore, and you're watching Livonia Television.